Good afternoon, everybody. My name is Taylor BRYSGEL. I am deeply saddened by the news that one of your relatives has been diagnosed with oral cancer. Hopefully, I can offer some comfort in educating you about this illness and providing some options for the next steps you should take and various treatment methods that have been proving effective in the past. To start off, I would just like to give a general overview of what oral cancer is. To put it simply, oral cancer is any cancer that develops in the tissues around the mouth or the throat. Although it is most commonly found in the tonsils or the tongue, as illustrated in this figure, it can occur anywhere in the mouth. So this picture reflects data taken from the United Kingdom from 2010 and 2012, and it shows a number of the places where tumors developed in oral cancer cases during this time. So as you can see, 2,140 tumors developed on the tongue, while 1,240 tumors developed on the tonsils, and these were the two most common places for oral cancer to develop. However, oral cancer also developed throughout the mouth, including the lips, the palate, under the tongue, by the throat, in the back of the throat, and in the gums. So oral cancer is just a very general term for cancer that can occur anywhere in the mouth. The most common form of oral cancer is oral squamous cell carcinoma. Now that's a very scientific term, so I'm going to break it down for you. Carcinoma is a type of cancer that occurs in the cells of lining tissue such as the skin. So throughout your body, you have tissues that lines various organs. It lines your body in the form of the skin, and carcinoma is a type of cancer that occurs in these lining tissues. Um, for oral cell carcinoma, it occurs in squamous cells. So as you can see in this figure, this is a picture of the skin and the tissue immediately under the skin. Squamous cells are the cells that are immediately below the skin tissue. So they're one of the most outermost cells in the body. And oral squamous cell carcinoma starts when one of these squamous cells is mutated and begins to rapidly proliferate and develops into a tumor. Oral squamous cell carcinoma represents 95% of all oral forms of cancer, so it is the most common type of oral cancer. There are many different risk factors that can make one more likely to develop oral cancer. I think one of the most obvious is smoking and tobacco use. When you smoke cigarettes, dipping tobacco, or just chewing tobacco, dip, cigars, they all are known to have carcinogens that can mutate the cells in your mouth and throat and cause them to become cancerous. The likelihood that you develop throat cancer is increased even more if you combine alcohol and smoking. Alcohol dehydrates the cells in your mouth, which makes them more susceptible to the carcinogens from cigarette smoke or chewing tobacco. Alcohol also removes antioxidants from the cells of your body, and without antioxidants, your cells are less protected from mutations that can cause cancer. So heavy alcohol use is also a known risk factor is also known to cause cancer in the mouth. Another risk factor is if a cancer patient has had HPV in the past. HPV, also known as human papillomavirus virus, is a sexually transmitted infection. Initially, when you get it, it just causes you to develop warts, like most STIs. However, over time, if HPV is left untreated, it can cause some cells to mutate and become cancerous. So HPV is known to cause cancers, especially oral cancers. Surprisingly, 27% of oral cancer victims have no lifestyle risk factors. That means 27% of all people who get oral cancer don't smoke, don't drink alcohol, don't have HPV. So therefore, there are some other risk factors that aren't that don't involve one's lifestyle choices, including their genetics or just their immune system. So some people are just more prone to oral cancer because of their DNA than others. Surprisingly, oral cancer is more prevalent in men. That may be because men smoke more than women and use chewing tobacco more. However, there's no correlation between the two. So people don't really know why oral cancer is more prevalent in men. But as this graph shows, um, Men are more twice as likely to get oral cancer than women, and you are more likely to develop oral cancer once you turn 40. So this the bracket right here, individuals from 36 to 45, that's when the number of oral cancer cases really begin to rise. There are many. There are a number of symptoms for oral cancer, including sores on your lip or mouth that won't heal, a mass or growth anywhere on your mouth, bleeding, loose teeth, pain or difficulty swallowing, trouble chewing, lumps in your neck. However, one of the most common symptoms for oral cancer is white patches within the mouth. So as you can see in this picture, this individual has a large white patch under the tongue. That white patch is a clump of abnormal and usually cancerous cells, and it's a sign that cancer is beginning to develop in an individual. So if you notice a white patch in your mouth, you should definitely alert your doctor. In terms of diagnoses, most oral cancer most oral cancers are diagnosed by the dentist. Every time you go to the dentist, they perform a routine 8-step checkup as outlined in this picture, in which they checked all parts of your mouth for the symptoms I just illustrated: white patches, abnormal growths, pain. So most oral cancers are detected by the dentist. If they do see something abnormal, something unusual, and they don't know if it's cancer or not, there is a number of tests they can do. One of the most common is using a dye called toluene blue. So toluene blue is a dye that is attracted to acidic cells. Cancer cells are known to be acidic. So if you put this dye on your mouth, it'll stain acidic cancer cells blue. So as you can see in this picture, the one on the left is the mouth before the dye, and when the dye is added, some parts of it are stained blue. That indicates an area of abnormal and cancerous cells. So toluene dye helps distinguish between normal and cancerous cells. If you're unsure if certain tissues are cancerous, doctors can perform a biopsy in which they scrape tissues from the mouth, look at it under a microscope, and study to see if it's cancerous or not. There are two types of biopsies. The incisional biopsy is when they cut a small piece of tissue off and they look at it. This is more expensive and obviously more painful because you have to cut part of the tissue off, but it is more effective. The other type of biopsy is the extraforative biopsy, which is just when doctors simply scrape part of the tissue off. They don't actually cut some of the tissue off. It's a lot cheaper, but it's not as effective in detecting cancers. So, like other cancers, there's four main stages of oral cancer. Stage one is when the tumor is 2 centimeters or smaller and it hasn't spread. Stage two is when the tumor has grown between 2 and 4 centimeters. Stage three is when the tumor is larger than 4 centimeters and has begun to spread, notably to the lymph nodes, which are right by the mouth, and that's the first place cancer is going to spread. Stage four is when the tumor is any size and has spread to areas other than the lymph nodes. So it might have spread into the bloodstream, it might have metastasized throughout the body, and that's when the cancer is most dangerous. As you can see in the figure on the right, the earlier you're able to detect cancer, the better survivability rate a patient has. So in the early stage of cancer, if it's detected in stage one or two, the patient has an 83% survivability rate. However, if it's detected in stage four, once it has metastasized and has begun to spread throughout the body, it drops to a 34% survivability rate. So early detection of oral cancer is key. Once oral cancer is detected, there are a number of treatment options that one can choose to undergo. Like most cancers, chemotherapy is a very viable option for those who do not want to have surgery. And for oral cancer, cisplatin is the most common form of chemotherapy. Cisplatin is an intravenous method of chemotherapy, so you need to go to the doctor and they inject it through your veins. And what cisplatin does is, as you can see in this figure, it binds to DNA and it prevents the DNA from being transcribed into proteins. And without proteins, the cell can't survive. So essentially, it kills tumor cells by binding to DNA and preventing them from creating the proteins necessary to survive. Cisplatin is often used in combination with either radioactive therapy um, or another chemotherapy known as FIFU, and in combination, it is known to be more effective in decreasing tumor size. if you don't want to undergo chemotherapy, there was also another type of treatment known as target treatment. Target therapy, or target treatment, or target therapy directly targets cancer cells by specifically targeting molecules that are known to cause cancer. So in this case, cetuximab is a viable target therapy option because it binds to growth factors that cause cancers to grow, that cause tumors to grow. So when it binds to these growth factors, it inhibits them, and the tumor cells are no longer able to grow, and that's what makes it an effective drug for chemotherapy, for target therapy for patients with oral cancer. Oftentimes, chemotherapy or target therapy will not work, or one may choose to go straight to surgery, which is known to be more effective. However, obviously, it's more invasive and more dangerous. So, surgery is also a viable treatment option for patients with oral cancer. Now, during surgery, there's nothing too complex or too intricate. The doctor simply just targets the area where the tumor is or where they know the cancer has spread to, and they remove it. So if you look at the patient on the right, this patient um, had developed a tumor on his lower jaw under his tongue, and as a result, the doctor had to remove large parts of his lower jaw where the cancer could have spread. The patient on the right, their cancer had developed into stage 3, so it has spread to their lymph nodes, and as a result, they also had to have their lymph nodes removed during surgery. Overall, cancer is known to be fairly effective form of treatment. 67% of all patients do not have that undergo surgery do not have reoccurring cancer after 5 years. And while 67% may seem like a fairly low value in terms of cancer, that's a good value. So surgery for oral cancer is known to be very effective. Now that I've talked you through all the treatment options for oral therapy, I just want to end my presentation on an optimistic note by telling you the story of Brett Butler. Brett Butler was a Major League Baseball player. He played center field from 1981 to 1998 on many number of teams. He was very good. He was an all-star, so he was a very high-level player. Like many Major League Baseball players, he was known to dip and use chewing tobacco. Unfortunately, this caught up to him in 1996 when he was diagnosed with oral cancer. Specifically, he was diagnosed with squamous cell carcinoma of the tonsils in May of 1996. Rather than undergo chemotherapy and potentially disrupt his playing career, Brett decided to skip right to surgery, and he had his tonsils removed in May. The surgery was successful, and despite doctors' predictions that he may never be able to play baseball again, he was actually able to. He returned to the LA Dodgers starting lineup in September of that same year, and he finished his season. He finished the season. He finished his career. Now he is a coach for the Miami Marlins, and the cancer has not come back. So this is just one instance out of many in which treatment and successful surgery has proven to be a viable option, and it has gotten rid of oral cancer in the patient once and for all. I would like to thank you for taking the time to listen to me, and I hope that you learned something. And if you have any questions on which treatment you think is best for your relative, just speak to me in private. Thank you.